The number one reason Americans file for bankruptcy protection is medical bills, and that is why some people welcomed President Obama's Affordable Health Care Act. But unfortunately, instead of making healthcare cheaper, it's actually doing the reverse. CCTV's Roza Kazan takes a closer look at one of the reasons why.
Switched all my services over to cloud.
Mike Goodman was 54 when a little over a year ago he felt chest pain and drove to the nearest hospital. He was diagnosed with a heart attack and had a surgery. Then came the bill, nearly $68,000, with insurance paying just under $4,000.
That's what the hospital expected me to pay.
$64,000.
That's ridiculous.
Goldman had paid $600 a month for insurance, but the insurance company refused to pay because the hospital was out of network. The closest one in network was 40 miles away.
You know, I'm having a heart attack. I'm not going to drive 40 miles to get to a hospital that was a network.
Goodman tried to dispute the bill on his own, but finally hired Holly Munger, a so-called patient advocate, a growing profession in the complex field of U.S. healthcare.
It's critical to many, many people. The hundreds of thousands of dollars that people are losing, the debt that they're in, and they have no idea if they really owe it.
The Medical Billing Advocates of America estimates 8 out of 10 medical bills contain errors and overcharges. Patient advocate Terry Dreher, a former nurse of nearly 40 years, believes hospitals make mistakes in a rush to get paid.
There seems to be a trend to get the bills out as quickly as possible. Getting it out fast is more important than getting it out accurate sometimes.
But sometimes her clients simply cannot afford to pay. 32-year-old Nicholas Eckel had a kidney stone and no insurance. The doctors refused to perform a follow-up surgery unless he came up with $1,000 in cash.
I'd been in the hospital, you know, in bed, in pain. So it just wasn't possible. There was no way I could, you know, just make this money magically appear.
Only after Terry intervened, Eckel got the help. The U.S. government says some 20 million Americans have gained access to health care thanks to the Affordable Care Act, or Obamacare. But simply having medical insurance is not enough. One study found that at least a quarter of adults say health care costs have taken a serious toll on their finances. Patient advocates charge between $50 and $500 an hour. Goodman says it was well worth it.
If she wouldn't have been able to handle it for me, I would have been financially wrecked.
After negotiating on his behalf, Munger was able to reduce his payment to $500. Goodman is now hiring her to dispute an emergency room bill for his daughter. Roza Kazan, CCTV, Chicago.